Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and Founder of Atlantic Coast Aesthetics. And Dr. Pane, this week's question comes from Facebook, and looks like the viewer is asking, what is their best liposuction or body contouring options for their body type here? And they've sent the pictures in. And Dr. Pane, what would you suggest in this case?
Yeah, this person is an upper 30s male who has lost between 30 and just under 40 pounds. Now here, you're going to hear a couple of different options. I'm not a big fan of a non-surgical approach for somebody like this because their main goal is abdomen and flanks, and they're fortunate enough not to have a body style with a lot of intra-abdominal fat. Sometimes we see men with a lot of intra-abdominal fat. They have this rounded and kind of a barrel abdomen shape. They can do some liposuction, but the effects aren't always as impressive on the front of the abdomen, but you do have some exceptions. So I usually like to see people in person before we rule them in or out for a specific procedure. In this case, the person does not have that kind of abdomen. Most of what they've got going on is in the lower waist. And that is the area that's going to respond best to liposuction. So I would steer away from some of the non-surgical things that you'll hear about for somebody like this. The question comes up is they don't have quite enough weight loss to really make an excisional surgery like a tummy tuck a home run for this kind of person, because in a man, we don't tend to do that procedure unless they lose a lot of weight or they really have a lot of loose skin or it really, really bothers them. That's because most men don't have C-section scars or anything like that to hide a tummy tuck scar. So it's not done as commonly in men as it is with women. But for this person, they are a good candidate for liposuction. And again, you're going to hear all sorts of different types of liposuction. Power-assisted, ultrasound, vaser, laser, you name it. The main thing is removing the fat and good post-operative compression and massage. We have used basically everything that there is. None of the technologies are bad. None of them, though, really provide results that go beyond removing the fat and good compression. I tend to use the power-assisted devices. I will use lasers, ultrasound, depending on what's needed for a certain situation. But in most cases, that is going to be the number one procedure here. Just removing the fat with some form of liposuction, good, careful post-operative shaping with garments and massage. And this person should do really well. I wouldn't think that the chance of doing a skin excision surgery down the line is going to be very likely. They probably will not want it. It's a possibility if they have some loose skin down the line and they really want it as tight as possible, but I would put the need for that in this case to 5 to 10% at most, not very high.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, Twitter, or Instagram account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.